Hey everybody, welcome back to my channel, Living Solo, Living Well, and I'm Kat. I am also a registered nurse. I'm 64 years old, and I wanted to talk about today nursing jobs that nurses can do if they're, let's say you've already retired or you want to semi-retire or you're just looking to quit the job that you're at for whatever reason and you want to start a new job. Maybe you want to do PRN or maybe you don't want to work very much. So I was going to give you some ideas based on what I've done and the jobs that I've applied for, the research that I've done to maybe help you to find whatever kind of PRN or a nursing job that you can do that's not full-time. So it can be part-time, PRN, just random. So I want to start off with, these are a couple places that I have recently applied to and have had interviews. So I'm going to start with the first one, and that is an occupational health nurse job. So back in November, I saw on Indeed or ZipRecruiter or something like that, a position for a PRN, occupational health nurse position. So I just applied for it. I didn't know where it was. It was local here, but I went ahead and just applied for it. And I had a message wanting to interview me. They were interested in talking to me and interviewing me. So we set up that interview, and that position was very PRN. So it was at this company sets up nursing clinics, medical clinics inside of factories. So this particular factory in town had an opening for PRN nurse, and they currently had one full-time nurse. So she was their primary nurse, and they were looking for just a backup. So let's say they had a flu clinic where you give flu injections, or she decided to go on vacation, or she calls out and needs somebody if her kid is sick. So the pay is excellent, and this is the kind of job that would not take very much time. I could say yes to it or no to it. If they call, it's PRN, so you can pretty much say yes or no, but you are hired under the pretense, not the pretense, but the premise that you're going to be filling in when they're on vacation, or you're willing to help with a flu clinic. And I'm sorry for the glare on my glasses. I have a window open to the side, so I'm going to try to keep my head up so I don't have that glare. But anyway, that position was ultimately filled with someone else. So they messaged or sent me an email and said they had chosen someone else, and thanks for applying. So about 2 weeks ago, I saw the same ad. And see, it was November before when I applied. So now this is January. So a couple weeks ago, I saw the same ad, and I went ahead and applied for it again. So I got the same response, and I did have a phone interview. I had 2 interviews the first time in November, and they chose someone else. So this time, the same HR or the same recruiter called me, messaged me, and wanted to set up an interview. And she recognized me from our prior, interview. So we spoke, and they were very happy that I reapplied because that person, it ended up falling through. She had a promotion at her other job and ended up working the hours that this company was wanting. So they interviewed me and then set me up for a second interview, which was a Teams interview. And so I will find out, I think I'll find out today or tomorrow how I got that, or whether I got it. I did have the interview just a little while ago, and it did go very well. So it's possible they may choose me. But my point in bringing this job up is that there are, contrary to popular belief among nurses, there are some really good, very PRN nursing jobs that pay well. So the next one I wanted to talk about is a nursing job at a local facility as it's a hyperbaric oxygen chamber technician. So I have experience with oxygen chambers, not very much, but just a little bit. I'm familiar with them. So I thought, what the heck, I'm going to apply for that. It's PRN, and it's very PRN. If they have some patients that doctors want to use the oxygen chamber as therapy, then they would know ahead of time and would contact me to see if I could be there. So the pay, I don't know what that pay is, but that particular facility is less than 1 minute from my house. So that's why I applied for it. And it's very PRN. So I figured, okay, that I could do a couple of PRN positions that didn't seem too hard or too, I guess, where you're on your feet for 12 hours like you would be at a hospital or a nursing home. So anyway, I do have an interview for that one tomorrow, and they required the people the applicants to be to have a professional license of some sort. So a nurse practitioner, a registered nurse, nothing lower than a registered nurse license-wise. And they had EMT that they would accept as far as an applicant. So this was not just a random job for someone off the street. You had to be licensed. And anyway, so I did have the phone interview yesterday, and I have the in-person interview tomorrow. So it's a second interview for that one. So I like the idea of having PRN jobs because you can say yes or no for the most part, but you can kind of tweak it around your schedule. And usually for PRN, the pay is very good in most cases for nurses. So the next one that I had applied for, well, it wasn't the next one, but I think it was one of the first ones. And that was with a healthcare staffing agency where you go to people's homes, and these are generally pediatric patients. So some of them are not, but a lot of them are. So this was PRN, and it was every other weekend. The pay was not great. It was okay, but it was 30 minutes away. And I thought, I don't really want to drive 30 minutes. If I can pick and choose, I'd pick closer than that. So the other thing I thought of is I am moving to my daughter's farm in about a month or so. And from that location, it's an extra 10 minutes almost. So we're talking about 40 minutes away. And for the pay, that wasn't that great. I just didn't want to do that. And the other thing I look for when I'm wanting a PRN job is the stress that it's going to take on my body. Am I going to be on my feet all day? You know, I injured my back several years ago, so I have a hard time with some different things, different standing, sitting for long periods of time. So the other thing about a PRN job that I love is, especially if it's local, I can pick and choose the hours. I can say yes or no, but I also need to come home and let my dog out to potty, you know, because she is my child, so I have to take care of my children. And I know that sounds like a weird thing, but in my younger days, I didn't have a dog and I worked full time. Then when I worked as a nurse locally full time, I was 5 minutes away, so I could drive home. I didn't have this dog at the time. I had my other dog. He was actually an inside-outside dog, so he was outside most of the time when I was at work. But if I wasn't there, he'd be inside. So I didn't really have to deal with coming home to let him out. I did do that, but that was not necessarily something that played into which job I took. So this time around, I want to have that flexibility because she's an inside dog. She's a digger, and I don't want to leave her outside because she, after, you know, for a 12-hour day, I don't know how long it would take her to get bored. Probably not very long. She's a very active dog, and she likes people. She's a people person. And so I thought I need to have something where I can come home and let her out if it's a 12-hour shift. So on that note, another job that I applied for was a PRN position at a facility here in town, and it's very close, 5 minutes away. They are 12-hour shifts. I don't know how I'm going to be able to do that, standing on my feet for 12 hours, especially with my back issues, but I'm going to give it a shot. You know, I haven't worked full time, and I haven't been on my feet for more than an hour or 2 hours at a time at a job to where I can't, you know, I'm not able to sit down. So I do have to sit down periodically because of the aching and the hurting in my back, my upper back. So anyway, this job is a PRN position. The pay is very good, and it's 5 minutes away or less. So if there is the flexibility for me to come home on breaks or at my lunch hour to let her out and go potty. So these are some options of things that you just have to look for. I know for me, I did not think I could find a PRN position that was really, really flexible with great pay that's local. I have worked PRN for hospice, but there's so much driving around. I loved working hospice as a hospice nurse, but the driving around it was just incredible. You know, I've also had a brain injury, which affected my vision. So I have prism glasses, and I have difficulty with my peripheral vision and with some other things. So working hospice or a job where I'm driving around a lot, out and about, you may potentially be out in the dark. And it's difficult for me to see in the dark because of the vision issues. And that's just not something I really am willing to do. But also with hospice, you have on-call. Most of the time for PRN, you should not. But this company where I worked before, they started implementing on-call for PRN nurses. So I wasn't willing to wake up in the middle of the night for a death visit or a call from a patient who might need medication. You can't get them medication in the middle of the night. So there's really, there's nothing you can do in that situation. But you would be required, if they called more times than one, you would be required to make a visit out there to make sure they're okay. Even though they're wanting more meds, you can't take care of that at night. They still the company wanted you to be able to go out, check on them, make sure they're okay. Because if they've called twice, there must be something wrong. And there's not. A lot of them are on very strong narcotics. Some of them become addicted to those meds, and they take them more frequently where they run out, and then they're needing more at the most inopportune time. So there's really nothing you can do at that hour other than having them wait until the next morning when their nurse, whoever the nurse would be that would go see them, could address that, contact the provider, and then call in some more medications. So anyway, these are options that I've had. So the nursing home or a facility that does 12-hour shifts, that's PRN. A home care company where you can do PRN, taking care of home care patients or pediatric patients, the occupational health nurse job, and the hyperbaric oxygen chamber technician position. So these are some of the interesting ones. You don't always find these. I've looked in the past, and this is the first time I've seen these types, especially the hyperbaric oxygen chamber position and the occupational health nurse PRN position. So these are just some ideas. If you're a nurse looking for something PRN and you really don't know, what's out there, look really good. I looked on Indeed. I looked on Monster Jobs. I looked on, what was the other one? ZipRecruiter. So I did have an account with, I think it's called Flex Jobs, and it's PRN and flexible positions, but you had to pay to see all the really good stuff. And I really don't want to have a membership in something like that when I can find some other things. So anyway, I hope these tips help you to find maybe a PRN job that you're wanting and you're just not wanting to work full time, or you don't need to work full time or part time. So anyway, let me know, drop a comment below what your ideal PRN job would be, or even an ideal job. And let me know what you've done or what kind of jobs you found as a nurse that work around your schedule. So until next time, I will see you then.